Well, good morning, everyone, and welcome to the Open Mic program here on Finger Lakes Country, WFLR. Lucas Day with you, and of course, in this time that we're currently in, no one's in studio with me. But we do have two guests on the telephone, and I certainly appreciate them coming in this morning to talk with us from Yates County Public Health. And good morning. First of all, I want to say good morning to Sara Christensen. Sara, good morning. How are you?
Good morning. I'm doing well. How are you? Not
too bad. Sara, of course, the Deputy Director of Yates County and Schuyler County Public Health. And joining Sara this morning is communicable disease nurse Chelsea Bailey. Chelsea, good morning to you.
Good morning.
Thanks again for both of you being here. Obviously, we're going to be talking about COVID-19, but first, the first question I want to ask is, you two have been extremely busy. First of all, I guess, Chelsea, I'll start with you. How are you doing?
I'm doing well, just doing what we're meant to do in this situation.
Well, God bless you. God bless every one of you that are in this, the front lines, if you will, in going up against what we are currently facing. And Sara, just an update from you. How are you holding up? I know a lot of long hours for you as well.
Yes, that's very true, because our jobs don't stop here at 4 o'clock as the days end. Chelsea and I work much into the evening, and I will say our sleep cycles are affected. I feel like we're able to function on 4 to 5 hours of sleep, which is good, but this is the role of the public health, and we prepare for this. That's why we have an emergency preparedness program at hand. We have plans in place. We do drills and exercises throughout the year, and we're just at times taking hour by hour here, really not day by day when it comes to public health, and the guidance and the executive orders issued by the governor are constantly changing, and we're just trying our best to stay up to date on the information to be able to better inform and educate our own community here in Yates County as well as the surrounding counties.
Sara, real quick before we really delve into COVID-19, obviously both of you being in this position that you're in and others in the healthcare profession, what advice would you give those that are on the front lines, that are facing these long days? Because they're up against it, and they've got to try to remain healthy as well, not only for themselves, but their families and other people they're in close contact with. What advice would you give those in the medical profession that might be running a little bit low right now on energy?
I think my advice is just to do the best they can. I think it's very important to take breaks, and I tell that to myself too. Sometimes you just have to walk away for, even if it's just 5 to 10 minutes, to kind of just regain your sanity and focus, and because I think it's very important to promote the mental health of us that are on the front line, and making sure that we're eating and maintaining our fluids and washing our hands and doing all of those preventative measures that we're preaching, and just reaching out. And I can tell you that I get several texts from friends with different memes and GIFs, and just the humorous side of it, I think, really does help get you through it too. And Chelsea and I text each other back and forth some of those, because I think, like I said, I think laughter is sometimes just important to get you through these long, hard days.
Couldn't agree more. Again, joining us online this morning is Sara Christensen and Chelsea Bailey from Yates County Public Health. And Sara, let's get right into it. What's the situation currently here in Yates and Schuyler counties as it relates to COVID-19?
I'm going to let Chelsea speak to kind of where we're at as far as testing and cases, and then we'll go from there.
Sounds great. Thank you. Chelsea, go ahead, please.
Yep, I can tell you, as in Yates County right now, currently we have tested 11 people. 7 of those have come back negative, and we are awaiting 4 more. In New York State, currently we're over 2,300 confirmed cases, and in the United States it's over 7,000. I know I can't speak for Schuyler's numbers, but I do know they have no confirmed cases as of yet either.
This is obviously a situation where you're in contact not only with Schuyler County as well, for obvious reasons, but neighboring counties as well. Is that correct, Sara?
Correct.
And what's the situations, the information, I guess, that you're sharing with these other counties? Is this on I'm sure on a daily basis, but maybe even on an hourly basis, that you're having this communication with neighboring counties.
Yeah, the public health directors, so our director, Deb Miner, is in communication with the other directors from the bordering counties of us, and I think they just are trying to keep each other apprised as best as they can if they do get confirmed cases, just so we're aware and we can prepare for our counties as well. So I think you do see the daily communication there when they can, for sure.
Let's talk about symptoms. I know that we've gone over this time and time again, but I think we can always go over, because people are concerned about symptoms when they should contact their physician. So I will ask that, what are the symptoms that we know of COVID-19, and when should people contact their primary physician?
The current symptoms that we are looking into is a cough. They're saying it's a dry cough, shortness of breath, and a fever. We're looking at anything over 100 degrees when we think about a fever. At this point, if you are ill enough that you feel like you need to be seen by a provider, we're asking that you call your provider before you go in. Otherwise, if you're sick, if you have a cold, if you have any kind of symptoms, but they can be managed at home, we're asking that you just stay at home, isolate yourself from other people, because you don't want to get people sick regardless of what illness you may have, and just kind of lay low until your symptoms have gone away or resided.
And Chelsea, as I understand it, it seems like other than symptoms that you just spoke about, primary care physicians and other people in the medical world are going to ask you some questions as well, in particular about your recent travel. Is that right?
Yes, those could potentially be asked depending on your symptoms.
Now, we're hearing about underlying conditions, people with weakened immune systems, and I know one of the questions that was submitted to us on our Facebook page was, are people with asthma more at risk? Talk about those conditions where, again, these people might find themselves to be a little bit more at risk because of some previous medical incidents in their medical history.
So at this point, we see that anybody can be infected with COVID-19. Now, the complications that can arise from that can depend on what underlying conditions you have, whether that is an underlying lung condition, diabetes, anything like that. They can all play a part in the severity of the illness and how it will affect you.
There's a lot of unknown, isn't there, with this? And that's, I think, what scares people. But at the same time, we can't certainly dwell on the negative. We've got to make positives out of this. And I know that's why the both of you are joining us here this morning on the Open Mic program to get that information out to our listeners. Again, joining us this morning from Yates and Schuyler County Public Health, we have Sara Christensen. Sara, of course, joins us on the phone, and she is the Deputy Director of Yates and Schuyler County Public Health. And communicable disease nurse Chelsea Bailey also joining us on the phone this morning. Sara, can you tell us what steps public health is taking in working with residents that have been exposed to COVID-19 if there is a confirmed case in either county?
Sure. So the Public Health Department is responsible in following up with anyone that tests positive for COVID-19 or is at risk for it. So there's just different criteria where at the local level we are going to be issuing mandatory quarantines or isolation, and then there's also precautionary quarantines that we advise individuals to do. And so that's kind of one of our primary roles right now, is just monitoring those individuals who are being tested by our healthcare provider community. And then the other piece is just trying to stay informed and informing our healthcare provider community of the most current updates that are being put forth by the State Health Department as well as the CDC. And so we have kind of that disease monitoring aspect, but we also have the role of the education and the communication of messaging to our community. And I think that's very important, and that's one of the reasons why I wanted to go live today, so our community members are hearing the local voices and hearing up-to-date information and the correct information, because there's so many different sources out there, and we want individuals to be looking at information from the State Health Department, your local health department, the CDC, the WHO organization for the most accurate information.
And again, Sara, for those that would like that information, what's the best way for them to do that, in particular in an online capacity? Do they do that through the public health website for Yates County and Schuyler County?
They can. Both of our websites have links off them to the State Health Department, the CDC, the WHO, as well as we have some general information on COVID on our websites.
Sara, in working with the hospital, Schuyler Hospital and Soldiers and Sailors Memorial Hospital, are they prepared to handle this? What's their situations at this time?
We have been in communication with both. I actually spoke with Finger Lakes Health last night, and they like us, they have preparedness plans in place. They do exercises, so, they are getting to the table just like we are at the local level and discussing options and next steps, because not only do we have to think about today and what our action steps are, but we're already looking weeks out of like what potentially could come, down the road if there is antiviral therapy available or a vaccine. Our minds are constantly running and preparing for the long-term aspect of this as well. But I'm very confident in our local health care systems here, primarily with Schuyler down there and Finger Lakes Health here. So I think they're doing a tremendous job, and we can't speak highly enough of our local providers here in Yates County. I think Chelsea's become very good friends with some of our provider office nurses these last few days, and I can't speak highly enough of our local labs and the staff here at Soldiers and Sailors in Geneva, and just such a great resource they've been in communicating back and forth with us and just all in this together. And I think that's one of our primary messages, is not only for the frontline workers, which starts with our dispatchers at 911, who are going to be inundated with calls probably in the next few weeks from the public, who then triage those to us, to just our healthcare staff, to our public health department, to our law enforcement, EMS, and our community. I just can't say enough of we have to do this together, and it's a kind of a day-by-day thing at this point.
And Sara, real quick, I know you can speak about the task force that was organized within the counties as well. Talk about all the different departments coming together and the plans that they have. It seems like, again, everyone is on the same page, and that residents should know plans are in place.
And it's very true, Lucas. And I think, as a county overall, we have come together. There's leads in each department at the table of the task force. We're all kind of every morning checking in and kind of updating each other and what each department is doing. And then overall, the county plan that our county administrator, Noni Flynn, worked with our chair of our legislator, Doug Paddock, on, and just different aspects we are putting in place. But the planning continues. It definitely does not stop.
Sara Christensen, Deputy Director of Yates and Schuyler County Public Health, joining us on the telephone this morning, along with Chelsea Bailey, Communicable Disease Nurse. We're going to have Sara and Chelsea, if they both allow, have the time, of course, on WFLR, on the Open Mic program. We're going to look to do this on a weekly basis while this continues to play out, and so we want to keep you informed, and we're going to come up with a weekly schedule where we can do that, and we'll do that a little bit later through either an email conversation or a telephone conversation. But Sara, and you both know, our lines are open to you at any time, of course, during this and any crisis situation that the counties face, but we'll talk about that. The both of us, or the trio, I guess, of us after we get off the air this morning. We're going to take a quick break on the Open Mic program. And again, joining us this morning, Sara Christensen and Chelsea Bailey. We'll take a break. When we come back, we'll talk a little bit more about COVID-19 here on Finger Lakes Country WFLR. And we're back after this.
Trout's Auto Recycling, Edwards Road, Waterloo. Trout's Auto Recycling.
We pick cars up, we crush them down.
Trout's Auto Recycling, Edwards Road, Waterloo.
This is Mike with Pinckney Ace Hardware and Appliance in downtown Penn Yan. Spring is just around the corner, and it's time to get grilling with the best names in grills from Weber, Charbroil, Big Green Egg, and Traeger. Whether it's low and slow for a pork shoulder or a high-temperature sear on that New York strip, we can show you all the features and benefits from our huge grill selection, including the new Weber Smokefire Wood Pellet Grill. Take advantage of free assembly and delivery on grill purchases of $3.99 and up at Pinckney Hardware, Ace, the grilling place.
The Yates County Chamber is closely monitoring the coronavirus COVID-19 pandemic as it relates to our communities within Yates County. The Chamber's top priority is the safety, health, and well-being of our community its residents and visitors. This is a rapidly evolving situation that changes by the hour, and there is a lot of uncertainty. The Chamber is doing everything they can to share important information with you that may impact local businesses and your family as it becomes available. The staff of the Yates County Chamber and Visitor Center offices will be working from home until further notice and will be available by phone and email during business hours Monday through Friday. The Chamber hopes you stay well and safe during this time. Our community is strong and we need to be there for one another. Together, we will prevail, one step at a time, always forward.
Hey friends, save big and make your wallet smile at Summit. Come see us and drive away with peace of mind in a certified pre-owned vehicle. We have many to choose from and each one passes a 172-point inspection, comes with comprehensive vehicle and powertrain limited warranties, and vehicle history reports. Find new roads. You get more from your friends at Summit Chevy Buick GMC, Route 5 Auburn, or online at summitcars.com.
Trying to bring barbecue and high-end craft beer to Geneva. My name's Kevin Nebraska from the Rusty Pig. We're almost dead center on Linden Street, right next to the microclimate wine bar there. The Rusty Pig is American food and drink. We do almost exclusively American everything in there. The essence of the pig is the meat, the smoke, the beer. That's where it is. I don't do anything without smoke and beer. We do things for vegetarians and vegans as well, but I think you'd be hard-pressed to find somebody that comes in there that can't find something that they love. Come check us out. We're the Rusty Pig on Linden Street, Geneva.
Along with Chelsea Bailey, communicable disease nurse with Yates County Public Health. And Sara or Chelsea, whoever wants to handle this, we've been talking about social distancing and how people can prevent the spread of COVID-19 if it does come to Yates and Schuyler counties. How can we help prevent the spread? Again, social distancing is key, but what other tips can you give to our listeners this morning?
Yeah, social distancing is kind of like the tagline right now in our community and what we're trying to really promote. And I think people realize what to avoid, right? The large gatherings, sleepovers, play dates, athletic events and all of that has already been canceled. But I think what we kind of want to focus, and I think people also know the basic prevention tips, right? Wash your hands frequently, disinfect surfaces, stay home if you're sick, avoid others that are sick. But I think we really want to stress to the community of what can you do, right? Because I think it's important both for the mental aspect of all of us as well as the physical health, just to make sure that we're communicating of what can you do when it comes to social distancing. And what we want to just stress to the community that you can still continue to go grocery shopping. It's just more of less use caution, trying to maintain that 6-foot distance between people. We encourage only one person from the family maybe going to the store. Try not to take your entire family or your children with you. We want to encourage people to go to the pharmacies because it's important that they stay on their medications or have them home delivered if they are, if your pharmacy offers that option. We want to make sure people are checking on their neighbors and friends, and whether that's through a phone call or a text or a FaceTime or a knock on the door, but still maintain that distance. And then I think it's important for people to know that they can go outside, take your kids in the backyard, shoot the hoops, play some catch, play hide and seek, go for a walk, get on your bikes, go for a hike. It's safe to kind of do all your regular day cleaning. You can do anything online from your computer, reading, listening, watching TV, getting all those old school board games back out, right? And I think it's just a time where we all are going to have to slow down and stay at home as much as possible. And I see that as an advantage of some of us because we all live everyday busy lives and running from here or there, whether it's kids related or we're involved in other community agencies and volunteering. And, I see people around at the dinner table every night having those conversations that maybe you haven't or connecting with that high school friend that you've been meaning to call or that family member. So I think it's important that there's still things we can do. And more importantly, support your local businesses. I just can't stress that enough. We all know the financial hardship that is coming for them. Chelsea and I was born and raised in Yates County. Chelsea was born and raised in Schuyler County. We're community members, and we know the emotions that are going on right now. And Chelsea and I, we are ordering locally every day for lunch because we don't have the time to pack our own, so we're depending on our local businesses for that need here, as well as often in the evening time, because when we get home, we just want to kind of put our feet up as well and maybe have someone cook for us. So I think that's just always important to remember what you can still do. But we want individuals to stay home if they're sick, and we just can't stress that enough, Lucas.
Sara, I just want to remind our listeners as well that our website, FingerLakesDailyNews.com, at the top of the page, we have a crawl activated, and you can click on that for local restaurants in the area that are open with delivery and the options that they are making available. So, again, please utilize that tool in thinking about, maybe getting that meal. If you don't want to cook on a Thursday or a Friday night, and just checking and seeing what is open, who is delivering, who's available for pickup. So that's a good reminder, as well as we're all in this together. We're all in this together. This is not just isolating a particular group. This is all of us, and we can all do our part. And you obviously raised some very good points. I want to talk, there's obviously a mental health aspect of this as well. How important is it for us to keep our mental health in check during these times?
Yes, your mental health is just as important as your physical health. It's really important during this time to really try not to focus on what you're missing out on or what we're not able to do, but really, like what Sara said, focusing on what we can do. Today's the first day of spring. We're hopeful that we're going to be seeing some nice weather moving forward. People should really be outside, get some vitamin D. Just taking a 5-minute walk outside really can do a lot for you. So, and if you're struggling, reach out to somebody. There's a lot of services available, even if that's just reaching out to a friend. But really make sure that you're keeping yourself healthy, not just physically, but mentally as well.
Yeah, and I think another important aspect, and I know I had to do this myself this weekend, and that's step away in particular from social media. There's a lot of information out there that people love to post, whether it's correct information or not, but you have to distance yourself from that as well. And I think, Chelsea, you brought up a good point. Get outside, enjoy the outdoors. It's going to be close to 70 degrees tomorrow, if not a little bit over, so enjoy that. I think that will really help, especially here in the Finger Lakes. But again, we're all in this together. I think of the World War II generation. We're all asked to do something in our lifetimes as a nation. And, you think of what our grandfathers and great-grandfathers had to do, and great-grandmothers and grandmothers had to sacrifice while we were in our 20s and 30s, or they were in their 20s and 30s, and, they had to storm beaches overseas. We're being asked to stay inside. I saw a great post on Instagram about that. We're being asked to stay inside and watch television. I think we can do this. I think we can get through this. And I think that's important to remember, that greater sacrifices have been made. Isolating yourself and just managing your social time, if you will. We can do this.
And you make a great point, Lucas, and we can't preach that more. And I saw that same post that you're referring to, and it definitely puts it in perspective for us that we can and we will. And eventually you'll see the headlines, Yates County has a confirmed case. It's just inevitable, and we want our community to know that we are anticipating that. Does it necessarily change anything that we're already proactively and preventively doing? Not necessarily. More guidance may come out, but I think that we're prepared for that. And individuals that are tested positive, we then begin a long contact case investigation, and the Public Health Department will be communicating to all of those identified as close contacts for then further instruction as far as a quarantine for them as well, and monitoring their health as we go.
Sara or Chelsea, I know initially there was a lot of comparisons, and I did the comparisons of coronavirus to the flu, and how is this more dangerous than the flu? Can you tell us the differences between the two as we know them right now?
Yes, we've seen a lot of comparisons as well, just because the symptoms are quite similar. But there is a difference. The flu has been a human-to-human transfer for as long as it's been around now, and people have a born or a natural immunity to that, whether you've been infected previously or you've had a flu vaccine. The problem with the coronavirus is that it used to be just animal-to-animal transmission, and as that is now developed from human to human, nobody has immunity. So that can be a really scary thing, but that's why we are promoting the social distancing. So that is why there is a difference between this and the flu. Yes, the symptoms may look similar, and yes, most people may have a mild illness that can be managed at home, but it's the people that will have the severe effects that we're trying to protect. So there are differences.
And what do we know now? I know that there were some test cases this week in terms of a vaccine out in Washington State. Obviously, this is a fluid situation as well, but Sara, do you know anything? Are we any closer? Where do we stand right now in terms of a vaccine for coronavirus?
Yeah, they continue to study, and we are trying to keep up on that data as well. I don't see it in the near future, maybe down the road, once they test it further and push out more of like the safety data and the FDA regulations and all of that. But it's definitely in the works, but I don't anticipate seeing that anytime soon.
Sara, again, if you can reiterate to our listeners what they should do if they feel symptoms of coronavirus, what steps should they take, and just reiterate again the process that they should go through and who they should contact.
Sure. One of our main messages is that if you are ill with anything, you need to stay home. And if you think that those symptoms or that illness that you're feeling warrants the need to seek medical intervention or medical care, we just are asking you to call your doctor's office first. And then they'll take over from there as far as asking you further questions and determining the need if you do need to be seen by their office or if it's more of an emergent need and you need to go to the local ER. But mild illness can be recovered at home, and that's why it's important to stay at home, because we need our hospital care systems available for our everyday emergent needs. I put this on my own social media posts: heart attack, strokes, congestive heart failure, car accidents. They don't stop because we're in a pandemic. So those beds and the availability of our emergency system is still needed for that, as well as those that are going to get COVID and then have more of a severe effect from that or illness, and we need those beds available for them. So the everyday person that has mild symptoms needs to just stay home, treat the symptoms, wait for them to resolve, and then they could also ask us for further guidance from there or their doctor.
Any information in terms of how people can contact public health during this time? What's the best avenue to do that?
So we have two methods. We have our office line, which is 315-536-5160. We also have a general public health email, which is publichealth@yatescounty.org. We also have after hours, which are more for our rabies and communicable disease needs. So if someone really has a true concern that cannot wait till our next business day, it's through the sheriff's line at 315-536-4438, and then they do contact our public health member on call. And a lot of people know me personally, so they can reach me by cell phone, personal email, or through Facebook. I'm here for everyone.
Well, we appreciate that, of course. Sara Christensen and Chelsea Bailey joining us this morning from Public Health. Again, during this pandemic, Sara and Chelsea both, we'd love to have you on a weekly basis. We can work that out off air here, but maybe we can work it to every Thursday, again, depending on your schedule, and I know it's going to fluctuate as we move forward, but I think as a service to our listeners in both Yates and Schuyler County and throughout the Finger Lakes, we would love to have this information on a weekly basis, and if you're willing to do it, we'd love to have you on.
We would very much appreciate that, Lucas. Looking forward to it.
Okay. Again, Sara Christensen, Deputy Director of Yates and Schuyler County Public Health, joining us this morning along with communicable disease nurse Chelsea Bailey. Thank you so much for joining us. Again, we know how busy you both are, and everyone in the medical world at this particular time. They're always busy, but a little more busy these days. We thank you so much for coming on and sharing this information with our listeners. And please, both of you, take care as well, you and your colleagues.
Thank you, and we wish everyone to be well and safe as well.
Thank you.
All right. Thank you, Sarah. Thank you, Chelsea. That's going to do it for the Open Mic program here on Finger Lakes Country, WFLR. News comes your way next. Have a good morning, everyone.